You're welcome back to Morning Express. Now, for the concluding segment of discussions on the program this morning, we are being joined by Dr. Sikiru Olanrewaju Badaru, who is the Director, Planning, Research and Statistics, Incident Manager, Influencer, and Coordinator of Pan-Respiratory Disease Surveillance at the NCDC. Now, main discussion for this morning will be Nigeria's preparedness against emerging global health threats, especially with regards to the HMPV virus. A very good morning to you, Doctor. It's wonderful to have you in the studio.
Good morning. Thank you for having me.
Thank you so much. First things first, I believe a lot of Nigerians would want to know what HMPV is in its full definition. Do you care to take us through?
Okay. HMPV is a human metapneumovirus disease. This disease is just like influenza. It's a flu-like disease, which is not that uncommon. It has been in some countries before now. It was first of all isolated in 2001 in Pakistan. In Holland. Yes. Then through the outbreak in Pakistan. So this virus has been in circulation since then, but not much important, as it has not been spreading. It's only spreading among the children and the aged people, which is just those are the vulnerable population. And then maybe the wave moved to China recently, and then apart from the other country that has been moving to it, it has already invaded the United States of America. Sometimes during the spring. It also affected Australia. That was about September last year.
Yes.
This has been, but it's now moving to China. It has a lot of cases coming up, and then most of the hospitals in China became overwhelmed. And for that, the news spread. Although China has not really declared to WHO then, until WHO themselves now intervene, and then they were now monitoring the situation.
Okay, fantastic. Now the China situation, Doctor, is it because of the reputation that China already has with regards to the COVID-19 virus that people sort of felt sprung out of China and then spread to the rest of the world, killed a lot of people? Nigeria had its own fair share of it. Could that be the reason why there's this so much apprehension in the air with regards to the HMPV?
Actually, the nature of the virus itself being a respiratory virus, and also the kind of ways China have been trying to manage internal health challenge also might predispose us to be a bit worrisome, because the experience from COVID-19, that SARS-CoV-2 pandemic really was a lesson for us. So everybody has to be on guard, not to take any chance, as we did in the past. So that was why maybe there was a lot of apprehension towards this new virus. Actually, this virus is a bit mild in
comparison to COVID-19, you mean?
Yes, in comparison, but there could be a new virus, a new strain coming up if it also has that capacity to mutate. So we are still studying the virus. We are not sure whether there could be any strain that will maybe virulent to the population.
Now, with your portfolio, Dr. Olanrewaju, and also your position at the NCDC, during the height of COVID, the level at which you and the organization beefed up a lot of modalities to ensure that COVID-19 was curtailed. Do you care to take us through what NCDC is currently doing to ensure that should in case there is any recorded case of HMPV within the country, there shouldn't be any further spread?
Yes, NCDC has already established a system whereby we continue to monitor cases of any eventual disease of public health importance or any public health event across the globe. We have our surveillance system,
Yes.
which is very much more intact, very robust, which can be of the normal indicator base. It could be community based.
Yes.
It could be collaborative surveillance. Any of these have been in place that we already established to also monitor any form of signal from any part of the country or outside the country. Once we receive this signal, immediately we receive this and we are having increase in the number of this signal being presented, we try to come up with what we call assessment. We call it a dynamic risk assessment to assess that particular signal or the disease that is now spreading, that has been spreading in that location, whether within the country or outside the country, to see how much we are exposed to the risk of this disease. And if we are even exposed to it, how prepared are we to that risk? And that is the first thing we did about this HMPV outbreak that is occurring in China. Immediately we had this, we got this information, we got this signal, we immediately called for that is dynamic risk assessment, which we conducted yesterday. And from the dynamic risk assessment, we have a lot of advisory for the public,
Yes.
for the state, State Ministry of Health, for the health workers, as well as for the public health decision makers. So we prepare all this now. We are already on
standby.
On standby, yes, and we've been monitoring it. And then what we discover from our assessment is that the risk for now in Nigeria is moderate.
It's moderate.
That it means we have to be at alert to see if there be any coming case into the country that we can easily arrest. And
now, I remember early 2019 when the COVID started, particularly in China, and started gradually moving into other parts of the country, of other parts of the world, including Nigeria. There were cases where people contracted COVID and got cured even without knowing. And you will hear somebody say it was much later that they discovered that some sort of cough that they had, or some sort of a flu that they felt was just normal flu, was actually COVID, but they did not realize that their immune system was fighting COVID without them knowing they had COVID. That has happened. In the case of HMPV, is there anything in particular to look out for persons to be wary of in the case that they contract the virus?
Yes, actually, for the young people and adults, it might be just an infection that might just pass through its normal course without much stress. Maybe the person may have some headache or fever or something, cold, after sometimes maybe running nose.
Yes.
Then it will just pass through it. It could happen, especially for those people that are very agile businessmen like that. It could happen. In the case of COVID-19, during that time, going back to the memory lane, I was also the incident manager for influenza.
Yes, the record is here.
so fortunately for us too, we are also aware. We are worried that we have many cases, rising cases of flu-like disease in the country that time. We are monitoring them. Some cases, actually, we lost some cases. They died. But we were so much worried that it was around that December when that is December 2019, that was when we were experiencing this.
Yes.
And in fact, we even monitor some cases up to some teaching hospitals to ensure that no, they were not COVID. Maybe during that time, all we were screening for was just influenza. Actually,
yes.
Which the whole thing came negative. But later, we did what we call retrospective survey to see whether those cases were really COVID. They were not. There were also new strains of influenza that are very, very virulent.
Yeah.
Now, that was those cases. But going forward, there may be a similar situation in this case of HMPV, whereby some people might have been infected back there in China and they move into the country, and even spreading it to that was why them spreading it to the populace without them even knowing. But that is why I said that we need to also make sure that we intensify surveillance at our point of entry. That is the borders, at our borders, most especially the international borders, especially the airports. That is the Lagos. That we have 5 major
international airports in the country.
Yes, in the country. So we must make sure that the Port Health Authority and these various ports screen any case that have that case definition that meet with severe acute respiratory infection, which is normally somebody is having cough and then also having fever. Once they pass through the screening,
yes,
and the person now is admitted to have that case, we've established a sort of collaboration with Port Health Authority under the Federal Ministry of Health and Social Welfare to ensure that they inform us so that we can follow up with that case immediately. So we were trying to establish some laboratories that will have capacity to quickly run such sample of the case when such case example, suspected case sample is collected, so as to confirm whether it is HMPV or not.
Yes.
So we have an arrangement.
Now, doctor, take us through. Reports say that HMPV has some sort of resemblance to COVID-19. You have also pointed out fever, cough, runny nose, headaches, and all of that. Yeah. Is there anything that sets these two apart? Because all of these symptoms are symptoms that could even be found in malaria or malaria patients. Isn't that correct?
Not correct.
Or some of them. Some of them are similar to even malaria patients. But are there clear-cut differences between symptoms found in COVID-19 infected persons and HMPV infected persons?
It was towards when we have severe cases, that was when the real presentation will show that the person will be having some sort of failure in
organ failure.
Organ failure, yes, which are stepwise. But most of them are respiratory as well.
Yes.
Which is also similar to that of COVID-19. The major difference is that the COVID-19 cut across all ages and sex. It doesn't discriminate whether you are a male or female, or doesn't discriminate whether you are young or old. But this particular disease, HMPV, focus on the elderly, the young, the immunocompromised individuals, those people that have cases like chronic diseases. So those are the ones that are really vulnerable to this particular disease, and they are the ones that get to the level of that severe conditions, which may be leading to organ failure.
All right, you have rightly pointed it out, and also you have mentioned that old people, the elderly, young people. When you say young people, is there like a demography? Are we talking about teenagers or are we talking about babies?
No, we are talking about babies, those people that have not really fully developed their immune system. That is people under 5.
Yes.
That is people less than 5. All those babies, they are the ones that are vulnerable for this disease. I mean, I think for now, it has not, any child that is from 6 years upward may just be free with it. He may just develop normal mild symptoms after all, then
the virus just sweeps through
yes, it's normal course.
Okay.
Yeah.
Is there any particular method, or apart from medication now, of sort of protecting oneself from HMPV that you care to take us through? You know, I remember in the case of Ebola, there was a time when, when persons had to bathe themselves in salt water and the rest. It was all over the country. And persons who had high blood pressure and or diabetes or any of those diseases also suffered even further damages due to, that spate of bathing with salt water. During COVID-19, everybody was taking ginger and garlic and honey, gulping it down and all. In this situation, what should people really do so that they don't, some persons don't mislead the public by asking them to perhaps bathe with ash water or salt water or any other thing?
Actually, if someone happens to have experienced some starting with fever then headache, then having running nose.
Yes.
This person should take caution by not spreading it to others by taking face masks to first of all protect himself.
Yes.
And also whenever he sneezes or whatever he handles anything, make sure that he wash his hand regularly.
Yes.
Then also move about with the hand sanitizer in case that he sneezes and then there are splage on his hand, and you use hand sanitizer to wipe off this his hand so that he will not be able to spread it to other person. Again, and this person should always take some analgesics just as the symptom is coming. You'll be treating those symptoms with some medication that can, but not by themselves. That person must go to the nearest hospital. If he could not, if he's experienced
to have these medications prescribed
properly, because it's according to the symptoms, then certain medication will be prescribed.
What argument?
No particular drug that can cure this
that not known yet.
Not known yet.
Now, one of the arguments that I think might spring up from this your statement is for persons who are not living in areas where they have easy access to proper medical health care, or persons who might not necessarily have the amount of funds needed to visit a hospital and get the proper health care that they need. I'm talking about homemade remedies. I'm talking about over-the-counter medication that people can easily get. Are there any particular prescriptions that you might be willing to give live on air for people who are watching us right now?
Actually, it is not advisable to always take medication. That's self-medication. We always discourage self-medication. But somebody can still take some analgesics, antipyretic drug that will reduce the body temperature. Then maybe take some vitamin C, vitamin B, all these all these supplements. And if you can take that, then that person should be isolated. The person should not allow those loved ones to come closer
to them.
To come close to them, so that they will not expose them to this risk. So the only thing, and then with time, I think the person will get over it. But once the person have adequate nourishment, and they also have all these supplements taken along with it. But for a person to take a particular medication or antibiotics, no, will not encourage that at all.
Now, doctor, you are very well aware of the spate of mass exodus of medical personnel out of the country, from Nigeria to other climes of the world for greener pasture, as they describe it. And it appears that our health sector suffers from a certain shortage of professional hands, doctors, nurses, and the rest. If there is a cause for a serious emergency like that of COVID-19 again, or even HMPV in this case, which you have sort of said Nigeria is at a medium risk level, but if Nigeria should be at a high risk level, do you think we are capable, ready, and well enough to tackle this issue?
Thank you very much. Even with the exodus of many medical doctors outside the country, there are still some dedicated doctors that are still on ground.
Yes.
There are some that they work in private organizations. There are some that also work with some of these non-governmental organizations which are on ground. And there could be possibility of those that move outside the country to even immigrate. They could. That possibility is there. But one only thing we have on ground is that we have a system whereby we can easily have, we have some list of some people that we can contact at any moment, any time, which is part of our surge register. So we can access and approach them.
That's the NCDC now.
Yeah, NCDC,
okay.
Yes. So that we can easily inform them that this is a case where you are invited to join us for this training. Then
please join us.
Join us, yes. There are people that we can still call on ground.
And you think that you yourself, the NCDC, and this other list of persons that you have called out will not be overwhelmed by this medical emergency?
I'm very sure of that. That we will not. We will not.
Now, doctor, let's digress a little bit. There is another issue before we come back to the issue of the HMPV. Let's visit the Vanguard newspaper in just a short while. Let's take a look at the Vanguard newspaper and take a look at a report springing in from Ebonyi State, where it says thousands face life-threatening ailments from lead poisoning. Let's have the Vanguard newspaper on the screen in just a short while, and then I would have you react to that story before we get back to HMPV. Now, on the front cover of the Vanguard newspaper in just a short while, you'd find the headline story, thousands face life-threatening ailments from lead poisoning. Varsity dons, medical practitioners, farmers raise concern. Ebonyi government flays federal government for poor supervision of miners. Laments miners fail to implement agreements with communities to provide amenities. Now, this is yet another medical emergency that Nigeria is faced with. I know everybody is screaming on top of their voices, HMPV, oh, China wants to kill us, China is at it again. But yet we have something that is killing our people on the ground, lead poisoning, that attention is not really being paid to as such. What do you have to say about this?
I'm not sure that attention is not being placed on it. I think
much attention is not being paid to it.
Maybe much attention
as we are seeing with HMPV.
Maybe much attention, but we have been on top of this right from for the past 2 years. We have been monitoring the one that has been occurring in Sokoto State, the one that even occurring in Zamfara. In fact, we've been trying to identify the major risk factors that is responsible for this. We're thinking of underground water may be responsible. We're thinking for major sources of this particular lead poisoning outbreak.
Yes.
Though I think there's need for government to regulate artisanal mining. If government regulates it, so the miners will now follow the proper procedure to protect the environment and also protect themselves and protect the product which they are getting from the mining industry.
Yes.
I think this is this is a key area that the government need to look into. But peradventure, we are on ground and we've been following up with all those cases. We've been trying to mitigate those people that have, the effect on those people that have been affected.
That's the coal miners and even people within these communities.
In community, yes.
Okay.
Because the lead level in their blood is so high, it's beyond WHO standard, and we know that person that predispose them to failure, kidney failure, and liver failure, and the rest.
Now, Dr. Badaru, I am not a medical practitioner. I might not really know the extent to which this lead poisoning can affect a person. Do you care to take us through how much of a grave danger is this for persons in Sokoto, in the northwest, for persons in Ebonyi, in the southeast, and every other part of the country where mining activity takes place, even in Taraba in the northeast, that there has been some sort of case of lead poisoning being reported?
Yes, people were not aware of the effect of the dust and some of the other things that comes out when they were breaking those stones. They were trying to mine the metals. But the major factor which is responsible for that is that the company that is in charge of this particular product producing this, they were not regulated. And they mean they were regulated. After all, other countries, developed countries, they also do mining, they mine things. And they've not moved into the technological past. They've not involved technology into the mining system. So
that's in other countries, or you mean in Nigeria?
In Nigeria, that was why we are having these exposures. So by the time the government regulates the mining industry and ensure that most of these miners use all the recent gadgets, they'll be following the new technology to mine all these mineral resources. I think this will grossly reduce. Then again, the people need to be advised when they are conducting or processing these mineral resources. They should try as much as possible to protect themselves by maybe putting on face masks and also putting on goggles. All this that so
protective wears.
Yes, so that they will not get themselves exposed to these dust, because these dust continue to percolate and they inhale it into their systems, and from there it is administered to their bloodstream.
What possible challenges, health challenges, could this lead poisoning lead to in the long run for persons who have been exposed to it?
Yes, in the long run, it could lead to constipation. It could lead to liver damage, kidney damage. It could also lead to loss of reproductive capacity or capability in men, mostly in men. These are some of the long-term effects.
So things like erectile dysfunction, infertility, and the rest.
Yes, these are maybe the situation at the end by being exposed to this prolonged exposure to lead poison.
Now, as NCDC, you mentioned that the NCDC has been on top of the matter for close to 2 years now, over a little over 2 years now. And do you care to let us in on your findings and perhaps what you have been doing to help some of these victims of lead poisoning who unsuspectingly fell into this sort of situation?
Yes, interestingly, we discovered that the cases that came up from Sokoto, they have a sort of maybe direct or indirect connection with the one from Samvara, because there is a sort of connection which
the value chain of mining,
yes,
gold and the rest
around that area.
Yes.
Aside that, we discovered that maybe there should be some underground water of which this lead now being absorbed, and that's the one that all these people are having access to for their drinking, for normal thing. And these cases always come up during the dry season mostly, because when the water level goes down, and then the concentration of this lead now become higher. So that is how these people got exposed to this lead poisoning. But during the rainy season, the cases always come down during the rainy season. So that there are more water and the dilution is there, and then the concentration of that lead is not as high as it was during the dry season. So we understand this, but we wanted to know which part of the stream or whether that is responsible, so that maybe if we provide from some other source of water for the community,
like borehole
water, yes, that is treated and monitored, that may grossly reduce these cases coming up.
Now you mentioned borehole water. Now, is it non-susceptible to some sort of infiltration of this lead?
That is what I'm saying, that we will monitor this borehole to know the content of the borehole, in terms of the element, the constituents of all this. We will always test for the metallic level in this borehole before we allow people to.
So it's still a work in progress.
Yes, it's a work in progress.
For persons living in communities like that of in Ebonyi State, where the Ebonyi State government is flaying the federal government for poor supervision of these miners, is there anything to look out for? Does the color of the water change? Does the taste change? What should persons really look out for in order to avert themselves from falling into this lead poisoning?
It is difficult for you to see, just to have a mere look at the water and say,
it's contaminated.
It's contaminated or it's not contaminated. The only thing is that people should not take any water from any place that is close to the mining site. People should try to either take pipe-borne water, which is from the natural source from the government, or also maybe they purchase sachet or the bottled water. So that will be safer for them in that situation. But for you to now say, maybe, George, you cannot, because it is until when this water is subjected to test.
Yes.
That is where you will know whether you will know the content of the metallic substance in it. So you cannot determine just by mere look.
By mere look at it.
Yes.
Oh, okay, fantastic, Doctor. You have made a brilliant point. We have about 20 minutes to wrap up this conversation. Now let's get back to HMPV. One thing that has always bugged my mind is why the constant need for HMPV virus to be hammered on the media, either by the government or by medical practitioners and all of that, and yet you sit here and you tell me Nigeria is at a medium risk of HMPV. Is there really something that Nigerians do not know about, and why is there so much apprehension in the air? Because in your opinion, we are okay.
Once bitten, twice shy.
Okay.
The experience of which China was not releasing the actual cases of, disclosing the actual cases of COVID-19 to WHO, make other countries to become so apprehensive this time around when they learn that there are such cases also coming up, and China has not been able to give details of what the number of cases on ground, the nature of the spread, and that's what brought about a lot of apprehension, and people were trying to be apprehensive.
Yes.
Aside that, it is just like normal diseases that have been coming up in some other parts of the country. After all, we've been having a H5N1 influenza, which is also very dangerous, occurring in the United States, which is from cattle to man, that is milk. And you see, but because the US CDC is on top of it and they are open, everybody knows what is going on, and they give feedback to the public, and people feel relaxed, because this is another dangerous virus which can mutate and then escalate to any level, even if it gets to the pig. But they were able to monitor it and contain it at that level. So also, I know that the China CDC, the China Center for Disease Control and Prevention, they are also doing things to their optimal level, the optimal level, but then they don't disclose what is on
the actual figure.
I'm not sure whether the actual figure. They don't really disclose the current situation to WHO. That was the challenge.
So that is why Nigeria is already apprehensive. That's why we, like you said, twice beaten. Once beaten, twice shy. Exactly. We just want to avert another reoccurrence of what happened during COVID-19, that many Nigerians lost their lives. Is that the situation?
That is the situation.
Well, fantastic take there, Doctor. In just a short while, just let us in on other things. Apart from HMPV, there are certainly other, health threats globally that, maybe not necessarily springing up from China. You mentioned the case of influenza or something like that. Exactly. Is there any other thing Nigerians should be on the lookout for at the moment, in your capacity as one who is privy to this information that we are not privy to?
Currently, the one that is also increasing in UK now is the same H5N1.
Yes.
But because and that is the focus of WHO now. WHO is now looking at the possibility, and that's been the one that they've been monitoring over years.
Yes.
For the past 20 years now. Two decades now. WHO have been monitoring influenza because it has that capacity and capability to mutate and to cause pandemic.
Yes.
So it's the one that is now coming up, having surge in some countries, and then calm down again, another surge in other country,
and then it comes down.
It comes down. Peradventure, if anyone will come up, it will be among the respiratory diseases. And that is why WHO is now not limiting it to influenza. They now said that we should continuously now monitor all sorts of respiratory diseases, because these are the diseases that we are much more exposed to. They are airborne and they can spread very fast. And for that, we have to quickly monitor them and ensure that any one of them can lead to an elimination of life, human race or something.
Yes.
So we should be on guard and be able to tackle them. And they call that program. That was about 2 years ago. WHO established that we should not only, from the COVID-19 experience, that we should not only focus on COVID-19 or influenza. We should focus on all respiratory diseases, and they call that program PRED. Preparedness and resilience for emerging threat.
Yes.
Yes, they call it PRED. That's what, and from that, other countries have not been monitoring not only influenza, not only SARS-CoV-2, they also been monitoring pan-respiratory disease, parvovirus, and some other diseases that could be having capacity, that could have capacity to or potential to mutate and also spread across the globe.
Now, during COVID, Dr. Badaru, one of the negative perceptions that persons had about, the response to COVID-19 was the COVID-19 vaccine that came in, the different vaccines that came in from outside of the country. Some Nigerians took the vaccines. They were like the first shots, the second shot, and all of that. Others were very apprehensive due to certain reasons or certain narratives that were flying around. I know you have said that there is no particular medication yet to treat HMPV, but should, in case a vaccine comes up, or what should Nigerians be expecting? Do you think that perhaps it would also get the negative reception that COVID-19 vaccines got at the height of COVID? Or should we now be relaxed and accept the HMPV vaccine, if there is any in the future?
I will advise Nigerians to admit that the best way to curb any imminent health threat,
yes,
is to immunize oneself, to protect oneself from being exposed to it.
Yes.
So that's the best way. That protection is by immunization.
Yeah.
So, and then, though our fear is that the technology is not coming from the country, it's from outside, and then some outside too, they have to prioritize themselves.
Certainly.
So for this, it's just what is ongoing now with the federal government under the administration of President Bola Ahmed Tinubu.
Yes.
They've already made a giant stride towards establishing vaccine production in manufacturing company in Nigeria now. We are already set. We are on ground doing that now rapidly, so that we're able to produce our own vaccines. And there are a lot of research that is ongoing now on vaccine research, that it's especially in case of Lassa fever.
Yes.
We're trying to look into some strains of Lassa that can be candidates, that can be the right candidate for vaccine production.
Yes.
So we are on that track, and if we could do that with Lassa, we could also do that with other diseases. So this is a potential that we are trying to establish in the country for now.
Now reports say that the World Health Organization has not yet declared HMPV virus a global health threat. How much of a life threat is this virus to individuals? How life-threatening is it? And why do you think that the WHO has decided not to declare it a global health threat, considering the entire situation that we had with COVID-19 springing up from the same China a couple of years ago?
Yes, for this one, it is still limited within the country, and for WHO to declare something to be public health emergency of international concern,
yes,
that event must not only occur within that continent, it must have spread to 1, 2, or 3 continents, and then also stabilizing after spreading, stabilizing within those 3 continents, and that is when WHO will now make that comment. Then they might also declare pandemic when the cases are now rising so high to the extent that it is now beyond each of the country's control. And that is that at that level, it means the WHO will declare pandemic. So they have those stages. But this one, for this HMPV, WHO is closely monitoring it in across all those countries that they are now presenting it. So they, until when they see that yes, a case has been reported in this country and that case is also spreading, that is when they will now make that pronouncement. Although recently we had a rumor that WHO or something like that, they said no, they were still on track, they were monitoring closely. If there's need for them to pronounce it, they will pronounce it. And again, about this issue of this when it even become pandemic,
Yes.
it only if there is a new strain. Like this virus is not the one that is so much capable of producing, so like the case
Like
of influenza
COVID,
or
yes,
COVID,
or COVID, yeah.
but it still has the same potential. If we have a new strain that may be virulent, and that was the one that may maybe expose or I mean make all age group become predisposed to it. Am I communicating?
I understand you.
But if it is within the normal range that it will only affect those 4 or 5 groups that I mentioned.
That you mentioned the elderly, the young,
the under 5, the elderly, the under 5,
and then the
immunocompromised individual, those people that have
underlying health,
diseases. Then those are the people that may be exposed.
I know you have mentioned that China wasn't, transparent with the real figures of what was going on during the height of COVID to the World Health Organization, and even now we are not certain that the numbers being rolled out are correct. But what is the fatality rate of HMPV, and how deadly is it really? Or mortality rate, I beg your pardon.
Case fatality rate or mortality rate is very, very low. From record, some of the one that we had that was reported in some countries, maybe in Pakistan, that one, the case fatality rate was mentioned that was about 13.5%, but it's and it was only among the under 5.
Yes.
And the country at that time, maybe it was due to areas that have poor health facilities and structures, so that's why they have a health constraint management. That is why we have such cases. But in a developed country like China, I think they've not really said that there were cases, but they know that they were overwhelmed. That was what they said. They've maybe 1 or 2 deaths have been reported, but they did not. We are not very sure of the numbers for now. But actually, the case fatality rate or mortality rate was we've gone very low, even lower than that of COVID-19.
Now, during COVID, Doctor, a lot of quarantine facilities were set up at the time when it became as if COVID was overwhelming the entire nation. Once bitten, again, twice shy. You mentioned that NCDC is on top of its game. It's already prepping things and putting everything in place ahead of any surgence of this HMPV virus within the country. Now, correct me if I'm wrong, this might have been within the city centers, Lagos, Abuja, Port Harcourt, Kaduna, and the rest. How about the rural communities? Is anything being done for them, especially communities that just have perhaps a primary healthcare center or clinics or maybe a village where the only health facility there is a chemist shop that sells over-the-counter drugs? Is there anything being done for those people?
Yes, we have been able to reach out to the community mobilizers. We have people on ground. We have the local government disease surveillance and notification officer at the local government level that also go on conducting surveillance. As you know, we will be going to all those, reaching out to all the health facilities and also interacting with the people in the community to know whether there are any cases being reported. So we have these people on ground that they also interact with the people in the community. And we've already sent our advisory to, that is why I said we have some set of advisory to health workers. So to the one that is to health workers also have been sent to all of them, and they will now take their position and then be able to try to play their own role in ensuring that they protect the community from being exposed to these diseases. And if anyone is coming up, they will quickly report to us that we have a case here.
And then you'll swing into action.
Exactly.
Well, we have just about 4 minutes or 5 to wrap up this conversation. Let us in on the role of the Ministry of Health, your organization, the NCDC, in the international community, or organizations like the WHO, and even ordinary Nigerians like myself, in ensuring that we, tackle this this issue, this virus that is not a pandemic yet. You have said it's not a pandemic, but how do we tackle it and stop it from, transcending beyond what it is now?
I think I will just start from you and me.
Okay.
Ordinarily.
All right.
So for us, is that we should be on guard. IPC, that is the infection prevention and control, is very, very important. That is personal hygiene, hand wash, and all this wearing of face masks, and then making people distance yourself from people. If you know that somebody is coughing unnecessarily, don't move close to the person. Just give some distance away so that you will not be infected. Or if you know someone is sick among your family, give him a particular room, isolate him there, let him or she stay there so until he or she recovers. These are some of the ways by which we handle that. At the health care levels, if anybody comes, make sure that you put yourself, you put on your PPE, and you follow the IPC procedure in that health facility, and ensure that if the case is beyond your level of control, do a referral, immediate referral to the next health facility, maybe from primary care facility to the general hospital, from general hospital to teaching hospital. Then you have quaternary, which are specialized hospitals in this country, and also move the person there. So make sure that this is in place, and then you follow that procedure. For the local government or the government at the local government level, the DSNO should also be making sure that get in touch with the community mobilizers and inform them of the situation. If there is any case, they should inform him, and then the DSNO should also relate whatever data or information you get to the State Ministry of Health. The State Ministry of Health should be on guard and also give advisory to the entire people in the state, and they should provide fund for any emergency so that they can respond to any emergency. Because we at the national level, which are now coming back to us federal, we are supporting the state and the subnational. Because when the response is beyond their capacity, that's when we come in to support them, both technically and with resources otherwise. But if it is not beyond them, they could handle it at that level, we leave them. So for our own level is that, yes, we will be monitoring what is going on the ground and also ensure what is also coming from outside the country through our borderlands, to ensure that, yes, the people in the country were not exposed to any form of imported health risk, and at the same time we were able to contain whatever any form of health risk that is within the country. And for our parent ministry, which is Ministry of Health, they are the one that are in charge of any authority. They have that right to declare if Nigeria has a case, they will be the first to declare it through the president of the country. So they are monitoring us, and we also report to them. Our DG this morning is giving the report of our assessment to the Honorable Coordinating Minister of Health and Social Welfare in presence of Professor Patti.
Yes, Ali Patti.
Ali Patti. So we are always abide by the regulation, because we are working for the ministry, for the minister to deliver to the president of the country. Yes, that is it. So that is just the lineage, that is just the direction. So on this, I think everybody is on guard now. Everybody is aware of what is going on in the country, and we also are at alert, and all hands are on decks to ensure that we protect Nigerians from being exposed to any imminent threat.
Well, Doctor, I must thank you so much. It's been quite an engaging and interesting conversation with you, and we must thank you for finding the time to come on Morning Express and for enlightening us about the HMPV virus and ways that we can protect ourselves.
Thank you so much for having me.
It's been a pleasure. Thank you.